Good, good morning and welcome, friends and the family of the Baltimore County Alumni Chapter of Delta Sigma Theta. I am Pia Sterling, the Physical and Mental Health Committee Chair. And this morning, on behalf of the chapter in particular, you have a treat. It is a collaborative event with physical and mental health and social action. We are bringing you the mental fallout of COVID-19. So just sit back and enjoy the program. And most importantly, we encourage you to take away tips on how you can apply this to your life. Before we start today's program, we always have a habit of just getting everyone engaged in the topic. So we're going to have 3 poll questions for you and just answer based on the first thought that comes to your mind. The first question is, do you know someone living with a mental health disorder or illness? And we will have the poll come online and you'll be able to select the answer to your question. Once more, do you know someone living with a mental health disorder or illness? And once you select your answer, feel free to hit submit. Thank you. Next question. Does the experience of racism and being Black in America increase the mental health issues in our community? The poll is coming online for you to submit your response, yes or no. And then once you hit submit, we'll share with you the answer. And once again, this is anonymous. We're just going to share with you the percentage of the audience that believes or may not. So there we have 92% of you all believe that the experience of racism and being Black in America does increase mental health issues in our community. Stay tuned to hear more about that. Poll question number 3, please. What organizations have resources to support individuals seeking information about mental health? The 3 here are NAMI, which is the acronym for National Alliance on Mental Health. The second option is Black Mental Health Alliance. And the third option here is National Institute of Mental Health. Out of the 3 organizations, which organizations provide resources? The first one is National Alliance on Mental Health, Black Mental Health Alliance, and National Institute of Mental Health. And the poll will come up for you to select what organizations have resources. All right, well, just keep that in your mind. I invite you all to write down your answer. And on Q&A, you may have an opportunity to ask a question. So once again, the question is, what organizations have resources to support individuals seeking information about mental health? NAMI, which is the National Alliance on Mental Health, Black Mental Health Alliance, or National Institute of Mental Health. Hopefully you have your pen and paper out. Thank you. Next slide, please. Now I would like to introduce our esteemed first Vice President, Lisa Settles, who will bring official greetings from the Baltimore County Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Welcome, Silver Settles.
Good morning, everyone. Thank you, Pia. Welcome and thank you for joining us this morning. As an organization of predominantly African-American women, Delta Sigma Theta Sorority Incorporated is uniquely positioned to promote self-care to the communities we serve. We advocate for physical and emotional wellness and actively engage in the legislative, judicial, and regulatory affairs of the state and our nation. Delta women emphasized the importance of political awareness and involvement from the very beginning. Our founders' first act of public service was their participation in the Women's Suffrage March of 1913. So as you can see, social action is in our DNA, and the Baltimore County Alumni Chapter continues that great legacy. Our physical and mental health and our social action initiatives are well known throughout Baltimore County. The Physical and Mental Health Committee has produced award-winning symposiums and workshops, hosted heart health fairs, and supported the March of Dimes and St. Jude walks. Our social action initiatives focus on voter registration, domestic violence awareness, and effectively protesting against social injustice. We are proud of these hardworking committees, yet we realize that there is more work to be done. As the effects of the COVID-19 pandemic continue to be realized, we are excited about today's panel of distinguished mental health providers, physicians, and community leaders, each bringing a unique perspective about the mental health fallout of COVID-19. We are equally fortunate to welcome noted author and professor Marita Golden, our moderator for the day. Thank you all for joining us. We look forward to an engaging and healthy conversation that will address mental health challenges with the level of transparency and compassion we all deserve. Thanks again to our committee chairs and members, and thanks to each of you for joining us. Enjoy this informative discussion and share what you learn with others. I now invite Hera Ojideu, a mental health practitioner and member of the Physical and Mental Health Committee, to share the occasion for today's symposium. Hera.
Thank you, Sora Settles. Good morning, everyone, and welcome. It is important for us to really understand the context of mental health and why we're here for this occasion. So to set some context for the background, the historical dehumanization, oppression, and violence against Blacks and African Americans have resulted in historical trauma and present-day racism. According to the 2018 National Survey on Drug Use and Health conducted by Mental Health America, 4.8 million, which equates to about 16% of Blacks and African Americans, report having a mental illness, with about 1.1 million of those reporting a serious mental illness. As a clinician, psychiatric health nurse practitioner, I'm excited that our committees are here to bring forth today's discussion on this symposium impacting our community with key objectives in mind. Those key objectives, shown on the next slide, are to initiate a healthy conversation about mental health in the Black community, understanding the general differences that exist, identifying gaps in legislation, and providing resources for our community. With that, I now turn it over to Dr. Marita Golden, who will introduce our moderator.
Good morning, everyone. Dr. Marita Golden, and I am the co-chair of the Physical and Mental Health Committee, and it gives me great pleasure to introduce our moderator, Marita Golden. Marita Golden is an award-winning author of 19 works of fiction and nonfiction. She is the recipient of many awards, including the Writers for Writers Award presented by Barnes & Noble and Poets and Writers, an award from the Authors Guild, and the Fiction Award for her novel After, awarded by the Black Caucus of the American Library Association. She has read from her work internationally. She is the co-founder and president emerita of the Zora Neale Hurston Richard Wright Foundation as veteran teacher of writing. She's taught at the University of Lagos in Nigeria and has served as a member of the faculties of the MFA Graduate Creative Writing programs at George Mason University and Virginia Commonwealth University. She has served as Distinguished Writer in Residence in the MA Creative Writing Program at Johns Hopkins University and Prince George's Community College, as well as the University of the District of Columbia. As a literary consultant, she offers writing workshops, coaching, and manuscript evaluation services. And relevant to this particular symposium, she has a book that recently received an award, The Strong Black Woman, and really talks about the importance of mental health as it relates to our physical health. So it is a true pleasure to welcome her as our moderator. Thank you.
Thank you, Sharita. And I just have to say, I'm really glad to be here. I want to salute the Deltas, as you are affectionately called, for continuing to support the Black community in so many ways. And back in 2017, when I wrote a novel, The Wide Circumference of Love, about a Black family living with Alzheimer's disease, the Deltas at that time had chosen the topic of dementia to focus their community activities on. And I was really glad to be able to speak at a couple of Delta programs. So I'm always sort of in sync with the very important initiatives that the Deltas are doing on behalf, not only of our community, but I think on behalf of our country as well. We have a great discussion today, which is going to be very comprehensive. And I think everyone's going to come away with a lot of questions answered and kind of a lot of assignments as you go back to your families and your communities. So I want to get started with the first panel, which is our panel of clinicians. And our two panelists for this part of the program are Dr. Dennis G. Antoine and Dr. Jonathan Shepard. Dr. Antoine is a board-certified psychiatrist specializing in addictions. He's a director of the Cornerstone Clinic at the Helping Up Mission and is a core faculty member of the Johns Hopkins Center for Health Equity. Dr. Jonathan Shepard is a board-certified psychiatrist, chief medical director of Hope Health Systems Incorporated, an award-winning mental health professional named top doctor in the field of psychiatry, and a distinguished fellow at the American Academy of Child and Adolescent Psychiatry. So I think, Dr. Antoine, if we can start with you. As everyone knows, the last 2 years have been more than challenging for our community. In some ways devastating. But at the same time, I'd like you to talk about the mental health aspect of COVID. What have we lost as a community and what have we gained? Have there been any strengths, any new awarenesses that this pandemic has given us?
Great question, and thank you overall for giving me the opportunity to be here today to talk to this great group. I would want to make sure that we talk about the awareness of what's been happening to our community, because I think that's the biggest thing that is a plus and a minus. There's been a racial disparity gap for COVID and also certain mental health issues, including opioid overdoses, which I deal a lot with on a day-to-day basis. So there's an awareness now that these things are disproportionately impacting the African American population, and there are systemic reasons for that, system reasons for that, and we're starting to talk about that more. The social justice aspect is something we'll probably see along the other panelists, but it's really been a higher awareness in the community that this is hitting our community hard, and we need to be able to deal with that. And I think for any type of treatment I work on with an individual, awareness is the first step. And we are now more aware. Increasing that awareness is going to be critical to making sure that we're addressing things properly. But with that has come just a sense of, I won't say depression, but demoralization, where we're feeling that this is hitting us. And for some people, if you're seeing that or feeling that for the first time and becoming aware of that for the first time, it can be a step back to say, all right, this is daunting. This is a lot. And so that awareness is a good thing in the long run, but in the short term, it can be a bit jarring. What I can say, though, is on the other end of that, in terms of what we're gaining, it's access to a certain degree. And one of the things that really has been access through telehealth. That's one big piece that's popped up. Some of the statistics out there show that before the pandemic, approximately 1% of outpatient visits were done through mental health. If you look at it now, in the past few months, you're looking at about 40%. And it's actually been a 32-fold increase for Medicare recipients. And still with behavioral health, you're looking at about 32 a full percent. So there's been a dramatic increase there, but that's tempered a bit because you're looking at the fact that we as a population have had a digital divide for a long period of time. And that means persons of color, African Americans especially, don't necessarily have the technology or the steady access to that increased access through telehealth that's out there. So it's something we have to juggle more. And I've been able to do some research in that area, looking at things like the FCC, who's been putting out pilot programs to figure out how we can connect our populations to these new resources that are available. So I think the plus is that there are a lot of people that are looking to fill that divide, and that's from NIH, SAMHSA, things even like FCC, and at the state level, looking at things like racial disparities, opioid overdoses, and task force that are being created. So this is a good time in terms of potential, but I don't think we're there yet to say that all that has been created into action that's going to help us out. But that is something I could say we have gained, that momentum that this needs to be addressed. But the statistics are out there to say that we have a lot more to do. So that would be my biggest thought of the gain versus loss.
What is the generational difference, that is, in terms of the expression or manifestation of mental health illness and mood disorders in young people versus, older generation?
That's a great question. I mean, the majority of the persons I work with, I always ask the question, is mental illness and behavioral health something your family talked about growing up? And a lot of them say no. So, part of it starts with knowledge of behavioral health. And when you talk about intergenerational presentations, the person coming to my screen may not even know what a presentation would look like in the past generation. So they have less awareness, again, to go back to that last question, less awareness of what it might be looking like. But I will say that with access, again, the younger generations, the more recent generations are more attuned and more connected to things on the internet and societal norms, just due to the way things and information come out now. So there's sometimes more awareness of what things can look like and more reactivity to that. But you would still see some differences between younger and older persons who might have depression or anxiety. And some of that comes from the biological piece of that, that the neurotransmitters aren't as well formed when there's a younger individual. So you might not see all the classic signs of depression, like a depressed mood. You might see increased fatigue. You might see some pulling back from going out with friends. Whereas with older individuals, you might see, again, not the depression piece, not saying my mood is bad or I'm a bad person, which is one of the textbook ways of looking at it. But you might see, well, it's nervousness going out to dinner or going out of the house, especially during COVID, where people are afraid of getting sick. So, that's one of the things across the board that can shift depending on the situation. But what has been shown across the board for African Americans is we're less likely to say, I'm not a good person or I'm feeling depressed, because we've generationally had to push through so much. There are going to be other things to look for. And I think the biggest thing is to make sure a person is able to function and have a good understanding of when something has changed that interferes with their function.
I think that's a great point that you raise about knowing what depression actually looks like, knowing how it expresses itself. And I think many of us, even very educated people, like many of us on this call today, may not really know how it expresses itself. I was at a university in HBCU earlier this week, and I asked the young people that I was speaking with, how many of them had families where they felt safe to express the desire to seek mental health support or to express that they needed support. And out of 16, only 3 raised their hands. Then when I asked how many of them felt like they would like to get mental health support, everybody raised their hand. So there is this disconnect between, the younger generation definitely is more open. Thank you for that. Dr. Shepherd, let's talk about microaggressions and just racism in society in general and how that impacts our mental health.
Absolutely. Well, first of all, good morning to everyone. It is good to see you. Thank you for this opportunity. Thank you, Dr. Marita Golden, for the committee, and thank you, and moderator. I am on here with two distinguished psychiatrists. I must acknowledge them, Dr. Dennis Antoine, who I remember he came through my rotation. I was a fellow, and he was a resident. So I don't know if that means that I'm older than him, but regardless. And Dr. Gail Jordan Randolph, how dare I not acknowledge her on this platform. So I'm going to answer your question. I'm going to be brief and try to get straight to the point. I got my cards here. I am ready and excited. And let me tell you, this question about microaggressions and about whether or not has it affected the emotional fragility of African Americans, well, the answer to that question is very easily, and that is yes, absolutely. How can you not be affected when the body and mind remain in a chronic state of fight and flight, and even freeze, a chronic state of stress? You're going to break down. And let me just say it to you very quickly. I'm a physician, so I understand physically, your immune system will break down. The ability to fight off diseases or infections is no longer there, or is, I should say, compromised. Hypertension, weight gain, breakdown of muscle and even bone due to the elevated level of stress hormones. So that's the physical part. Then the emotional or mental part. There's a term, I'm reading this book called Uncomfortable Conversations with a Black Man. If you haven't read it, you need to go read that book. But it talks about racial battle fatigue. And I'm sure you all have heard of that term. So mentally hyper sensitivity to various events, increased anxiety, burnout. Again, we've heard that term so much. The inability to say no, blurred boundaries, all of that goes along with the emotional fragility due to COVID-19 stress. So those are some of the things. And then I want to touch on an area that is just as important and sometimes gets neglected, the spiritual aspect of our emotional fragility. Absolutely. And I'm going to hit it just as hard as I did the other two. How dare we not understand that when we've been under this chronic state of stress, that we may lose our identity or even sense of purpose in life, that many times we get through our spiritual feeding and our spiritual leaders. We may even stop prayer and meditation, things that we know to help us. So what it does is, and I'm concluding here, is that it attacks our PCWC. That is my acronym. That is my trademark for every time I talk. It talks, mental health relates to 4 tenets: P, potential; cope; W, work; and C, contribution. Your mental health is the state of being. And this is according to the World Health Organization, not my definition. I just took it and broke it apart. It means mental health is the state of being where every individual realizes his or her own potential, can cope with the normal stresses of life, can work fruitfully and productively, and then make a contribution to your community. So when you are going through what we're going through, yeah, it's going to attack your PCWC.
Amen. Amen. That's a great lead into, the next question, and that is about suicide, which is a topic that has been taboo in the whole society for many years, and now is finally sort of creeping out of the closet. And it's one of those subjects that, along with the pandemic pushing things to the forefront, we're now beginning to talk about the very high suicide rates in our community. And there was just an incredible article written in the New Yorker magazine by Andrew Solomon about the increase in suicides among young people across the board. And he profiled a young Black boy who was 9 years old who committed suicide. And we're all baffled. How is this happening? Why are 9-year-olds killing themselves? And let's talk about Black people and suicide.
Yeah, it's real, and it doesn't need to be creeping because it's been there. Mm-hmm. And I hate to say it, even before the pandemic, ages 5 to 12, Black youth, they were the highest group between ages 5 to 12, Black youth, highest group of children or people within that age range that were committing or completing, that's the word I like using better, suicide. Again, anytime I do stats, you can go check me out. American Academy of Pediatrics is all up in there, and it has not decreased. All right. One thing I also noted too, as I was preparing for this, in the state of Maryland, where we are, between March 5th, 2020, which was when the first COVID-19 case was reported in Maryland, and May 7th, 2020, that was when the first reopening of public spaces in Maryland, believe it or not. And even between May 8th and July 7th, when there was a progressive reopening, suicide mortality increased for Black residents in the state of Maryland. Pause. While decreasing for white residents. Pause. Troublesome. And let me tell you just about that particular stat, because when you look at and you compare it between 2017 and 2019, it actually doubled for Black residents in that time period, just those 4 months. Whereas again, for the white residents, it halved or decreased. That's troublesome. And some of the people said, well, some of the reasons were necessarily, greater capacity for remote work or benefits from relief efforts.
Right.
And that may be true. That may be true. White privilege is still existent in this country, is alive and well. And you must understand, when people tell me that, I don't care if you want to be, try to be equal or equity, the word is equity. Blacks are still not able to run a fair race in this country, especially when whites have been given a 400-year head start. So don't even go there with me on that. But in addition to some of those things that I've just discussed, one of the other things I also note is that societal norms have also increased or contributed to this increase in suicide rates. So what are you talking about, Dr. Shepherd? There's an increase in despair and hopelessness in this country that I have never seen before in my life.
America literally drives us crazy.
Yes, and I'm seeing it in my office. And I don't care what race or whoever you are a part of.
Exactly.
People are talking about the level of complexity of mental health cases that are coming into our offices. Psychiatrists are burned out. I got an article right over here talking about burnout in psychiatry. I'm revived, which is very different from others because I understand my calling and mission. And so I know how to be able to take care of myself. But if you don't know how to do that, then you will get caught up in that whole increase of despair and hopelessness. Also, what is a problem too is immediate gratification. This need for immediate needs, and if they're not met, and I'm gonna kill myself. It's ridiculous that I'm hearing and seeing. Self-esteem, bullying, these are other major causes for why children age 9 are killing themselves. There's a thing that I talk about also when I give presentations, the 3 A's that have come out of the COVID-19 pandemic, which is anger, anxiety, and apathy. They are at an all-time high. People are angry, all right? They're mad. You can't even drive down Liberty Road. For those of y'all who are in Baltimore County, I want to give y'all a sense of reference where people try to cut you off for no reason. It's ridiculous. Anxiety, you can't go in a store and sneeze without being arrested because they want to know, are you sick? And then apathetic. Our children are not learning because the teachers don't want to be there, they don't want to be there, and their parents are not sending them to school. Now, I know that's a gross exaggeration.
Sure.
But let me tell you, it's happening more commonly than what you would believe.
Oh, yeah. We hear you.
So there's a distortion, and I'm almost finished here. The distortion of or no conflict resolution. We don't know how to be able to resolve our issues, which is leading to increase in homicides and even suicides. I also talk about the healthcare disparities, and then I'm going to end. Healthcare disparities.
Yeah.
So when we have these healthcare disparities, lack of access to mental health and poverty. So even when we identify a child or identify a person who's in need of mental health care,
they can't get it.
we can't get it.
They can't get it.
So all these different factors. So I just don't want to sit here and say it's racism. Racism has been here for a while and it's not going nowhere.
Sure.
So we have to understand that there are other things that are going on. And let me just say this real quick, because there's another form of suicide, and I'm done. You can arrest somebody in their development and growth as a people, and that is a form of suicide.
Yeah. Another amen. I think that now's the time that we want to take some questions, and what you seem to be describing, both of you, as a society in the midst of a psychotic break. And that's why discussions like this are so important. So Sharita has, do you have any questions from the audience?
I'm about to send you one. I think there was
Okay.
one question about if Dr. Shepherd could talk about the resources through the Black Mental Health Alliance, and I will send along another question.
Mm-hmm.
Absolutely. So resources, Black Mental Health Alliance, I'm a proud member. I am the board president, have been since 2014. And not just I'm a proud member because I'm the president, Lord, but because we do good work. I'm thankful for that. So become a member, look us up, Black Mental Health Alliance, donate. We have an upcoming symposium on June 29th and June 30th, where we're going to be dealing with racism in mental health. You need to be there, beat me there. So we are looking forward to you all joining us on that date. Just Google us real quick and you can join. But I also want to make sure we support our other national medical organizations that target Blacks, such as the BPA, Black Psychiatrists of America, National Medical Association, NMA, the Black Psychologists and Social Workers, and then encourage your youth to consider a career in mental health. That's how we need to increase the workforce, support our HBCUs, advocate for more resources. Check out, we're in the middle of a political season. Ask these people, do they support mental health resources? You need to ask them these questions, get in their business, find out where they stand on that so that we can make sure that we're putting the right people in place. And know that 988 is coming out too. That's a phone number where you can dial if you're in a suicidal crisis or a mental health crisis. So my national hotline, 988, starts July 1st of this year. So again, support Black Mental Health Alliance. I don't have a shirt for that, but I had to find a red shirt for the Deltas and told me to do good. So that's why I had to come with no bow tie today, but I just came ready.
Thank you. We have a question about social media. Dr. Antoine, do you want to weigh in on that? How does social media impact mental health? On the one hand, you have Black Twitter, which was a great force for empowering Black people during the pandemic. And so it gave us a sense that even though we don't have power, a lot of power politically, et cetera, through shaming, through talking about it as a group, we could affect change. But we know there's a negative impact. Talk about the mental health aspects of social media.
Yeah, I think social media is a form of communication, but we also have to think about two aspects of that. One is that it's an influencer, and it influences us just as much as we try to influence it. So we don't always know who's putting the information on these social media places. It might be from within us, but a lot of times that information is shaped by other forces, and it's hard to distinguish that. So at the same time, it creates our norms of what is acceptable to do. And just as much as you talk about Black Star, I think most people on here might know what World Star is. And that also creates a norm. And we have to think about how unconsciously that can reshape our thoughts and also reshape how we communicate, because if those patterns of communication are the only thing that we use in our regular lives, the real world, not the social media world, then we might end up being stunted in how we're able to communicate and just think that is the only way to use shame or a quick statement, and not have the conversations that's needed to build relationships and build support to get through these tough times. So as I say to a lot of people, the internet is not real life. We got to make sure that we supplement that with the rest of what will really sustain us long term.
Yeah. How do we deal with the mental health issues that, because Dr. Shepherd, you mentioned teachers being burnt out. How do we, because our young people, our children, are with teachers almost to some extent more than they are with us during the day. So how should educational institutions and even teachers address this issue?
Absolutely. So they got to partner up with mental health resources. I'm a proud partner of Hope Health Systems, and we provide mental health services within Baltimore County and Baltimore City schools. So we're there to support the teachers and to support the parents, the community, so that our students can get the help. And in addition, if the teachers need the help. So it's got to be a situation where we are helping one another. And so we've got to partner with the mental health resources that are out there. Yes, I know that there's some organizations there that have some budget cuts because the funding is not there. But let me tell you, there's still enough people out there who are doing the good work. And so that's how we must support the teachers.
Dr. Jennings, did you want to conclude this by this section by saying anything about that issue? About supporting, teachers and others.
I think, and I probably should have put this in my first question response, that partnership, as Dr. Shepard said, is going to be key here. And it's, going to be the schools, but making sure we're in the places where our community already is. I'm doing a mental health initiative right now in a barbershop. And
that's great.
Yeah, we have a DJ there on Sunday, Saturdays, and we have information out there. Also doing more things in the churches. And there are certain churches that are setting up mental health clinics in the church itself. So I think we have to make sure we partner to address these issues of mental health and suicide, not just in the health facilities that we're used to having people travel to, but just put it in the places where they already are, so we can recreate that norm, because ultimately the best social media is the one where we have pro-social behavior, and that should be in our established community resources and gathering places.
Well, thank you both. We are off to a great start. And now we're going to move to the next panel, the health, consumer, and graduate student perspective. And we're going to hear from Sharon Lawrence, who's a licensed clinical social worker, founder, owner, and lead therapist of, I'm not sure I'm pronouncing this correctly, Selah Wellness and Therapeutic Services. And she has 20 years experience working with children, adults, and couples, as well as Ruby Turner, BS, graduate student and MSED candidate at William & Mary School of Education for School Psychology. And in her undergraduate research, she's focused on exploring cultural factors that influence help-seeking stigma among Black African-American college students. So thank you for joining us today. I want to start with Ms. Turner. Can you talk about your personal journey, which led you to pursuing a career in mental health?
Thank you for this opportunity to speak. In middle school, I was exposed to different groups of people where some of my friends were struggling with mental health, some of them weren't, and that kind of got me interested in the field, as well as marine biology. So I had a really weird introduction to psychology overall, but that's where it started. And when I got to undergrad, I got really involved with psychology, research, the neuroscience field, and mental health. But currently I am studying school psychology because I wanted to tie my love and passion for education and my love for mental health into one role, which is what school psychology does. So it's a mix of how I got here.
Yeah, we've touched on this a little bit, the differences between generations in terms of the stigma around mental health. And how did it affect you personally during COVID and sort of your generational cohort? How did COVID impact your experience with mental health services?
I would say it became more accessible for our generation because more therapists went online, more celebrities were advocating for mental health. So you would see it all over social media, like get involved, take care of your mental health, do self-check-ins. That became a common topic of discussion and it still is today. if you look on social media for people to get involved, to check in with themselves, and it's not as much of a stigma around it. It still is something that people are cautious of talking, especially in the Black community. However, I think people are becoming more comfortable with addressing the traumas that we have, addressing the traumas that have been passed down generationally, and trying to figure out how we can heal for ourselves and even for our parents and those before them.
What would you say to a young person who lives in a family where there is stigma around talking about mental health, and yet they want to talk to their family members about it? What would you say to them to get that conversation started?
I would say the first step is to build trust. I'm one of those people who I don't talk unless I trust the person I'm with. And I know that's a lot. That has a lot to do with even my friends. They don't go to therapy if they don't trust the person that they're talking to, because we know there's a stigma. You have to look like you're always strong. So you want to make sure you trust the person that you're talking to. And most of the time, once you're trusting with that person, it's easy to start having conversations and breaking down the barriers of like the stigma that they have. And if it's with their family, it's definitely going to be more work. But I think building that alliance with the person, getting them to realize that you have to take the step for yourself. It's not about your family. What your family thinks of you is what you think you need for your health and for your well-being overall.
So basically find that person or persons in the family structure that you do trust. What if there's nobody in your family that you trust? What about?
I believe you can find outside of your family.
Exactly. Expand the definition of what family is.
Yeah.
Thank you. Ms. Lawrence, what approaches do you recommend for stress reduction to support mental health and wellness?
Good morning, everyone. Thank you for having me. I'm very grateful to be with you all this morning. Ms. Golden, the first thing I would say is awareness. You have to be aware with how stress is showing up in your life. There are so many people who are like on automatic. It reminds me of that when you get in the car and you push that start button and you just go. And there are so many people that are functioning without recognizing what's happening internally. So you have to be aware. That's the first thing, how it shows up for you, because it can look very different for many people. For some people, it shows outwardly. For other individuals, it may be internally, like a tornado or a silent storm that's going on. Folks can look at you and say, you look great, and they have no idea what's happening on the inside. And so it's important to know what that looks like, and it can show up with fast heartbeats, digestion issues, fatigue, headaches, restlessness. For some people, they may isolate, sleep a lot. It may impact their appetites. It may even also increase their risky behaviors, so if they're already involved in stuff, or maybe they don't have that, but now they're stepping out and doing things that they don't typically do, it can show up in that way. And so I think, like Ms. Turner said, it's a personal journey. In order for you to address it, you have to be aware and you have to become active. And whatever that looks like for you, you have to figure out what that personal thing that's going to be key in addressing those stresses for you. That could be meditation, that can be prayer, it could be journaling. I always add gratitude, because when you partner gratitude with journaling, you increase your chances of reducing depression and anxiety. Assert yourself, set the boundaries, and don't feel guilty about it. So when you're putting things into place that protect your emotional well-being and what it is that you need to do for you, do it with confidence, do it boldly, sleep, put a plan of action in place. And then last but not least, get a counselor. Get a counselor. Be willing to talk through things before they become worse. I'm a therapist for therapists, so I'm always helping the helper to understand why this is so important. So I'm always encouraging individuals. The first step is saying, let me go and sit and talk with someone who has a neutral perspective and can help me bring some things, into light, and I can deal with them effectively.
I think you're also hinting at the role that we each have to play in supporting one another. I mean, I think it's important if we see a family member or a friend clearly not looking like their best selves, that we say something. I had an incident where a very close friend just simply didn't look vital. She didn't look energetic. She didn't look like her best self. And I mentioned this to her. I said, I don't know what's going on, but you're not presenting your best self. And a couple of months later, she sent me an email thanking me for saying that. She said, what happened is we're in the midst of COVID. I'm in a PhD program. I'm homeschooling my son. I threw my back out. And when you said that to me, I realized I needed to get back into therapy so I could get a tune-up to learn how to deal with these new stresses. And a lot of times we feel like, oh, I can't say anything because I may hurt the person's feelings. How do we get over that?
Say it, do it. You're helping. If your intentions are well, and you care, that person should be able to recognize in that present time, or in the case that you just mentioned, months later, they send you that message saying thank you. I think that is one of the things that has been a big issue during COVID, is that people are missing the fact that everyone is impacted by life, that we are not exempt from stuff that comes our way. I've had friends and colleagues who assume, oh, she has this, she's a therapist. And I say, no, hey, help. There's a meme where the person hand is out of the water and they're saying, help, I'm drowning. And the person comes up and goes, good job, and lets the person just fall underneath. And I think we have to be mindful that we, check on your strong friends, but I always say, just check on your friends in general, whether you think they're strong or not. Hey, how are you doing? Are you okay?
We have a question before we move on to the next panel. That is, how do we improve partnerships with school districts to ensure we're serving our students well and meeting their needs? Either both of you.
I would say make that phone call, find out who the point person is, who's over the counseling programs, see if there's any other resources already in place, connect with social services. A lot of times they have counselors who are also placed in the school system. So there may be opportunities for you to join forces with them, whether it's an evening event, whether it's virtual event, but making sure that they're aware of whatever services that you're providing, and that they're also aware of what free resources are out there.
Ms. Turner, did you want to say something? Or?
Oh, no, Ms. Lawrence covered all of them.
Okay. Thank you. Thank you both.
So it looks like we have time for a few more questions.
Yeah, I think there was one question I want to ask about the, I think I may have sent Marita an audience question before one of our last questions to ask Ms. Lawrence in particular about, is prayer enough? So how can people balance their faith, sort of feeling that they are in some way not being true to the actual treatment?
Faith and mental health is very important. There's actually research that says integration of your faith in your treatment really does help you improve your symptoms and make great improvements. I will add that, as a believer, I believe that prayer is extremely powerful, and that there are situations where when you pray, you look up and you go, wow, my prayer is answered. But there are also a lot of scenarios where prayer requires a lot more action. And so when I have individuals who are, whether clergy, leaders in ministry, or just someone trying to walk with their faith, feeling guilty about integrating mental health, I let them know that that scripture that says faith without works is dead, that works can include your therapeutic process, your therapy journey. And so it is okay to partner the two. One does not cancel out the other. And so I also allow them to integrate their faith as a part of their treatment. So we talk about what's important to them spiritually, in addition to looking at other areas of their life that is very important. So helping them to understand that is their safe place to make sure everything that matters to them is a part of their therapy journey.
When I was doing research for my book, The Strong Black Woman, I was very impressed that a number of the women who shared their journey into mental health and healing talked about praying their way into counseling, praying their way into therapy. And I do think the younger generation no longer sees that dichotomy between faith and mental health, the way that sometimes the older generation did.
Yeah, that's very true. They are looking very different these days. Yeah.
Are there any more questions from the audience?
There's a question coming. I just typed slow.
There's a question in the chat. What's your advice for finding a good therapist?
I would recommend looking on different directories. I'm actually going to list them all in the chat as well. But one, you can look up cliniciansofcolor.org. There is therapyforblackgirls.com. There's therapyforblackmen.org. There is melaninandmentalhealth.com. There's also Psychology Today. There's Open Path Collective, which is typically for individuals who do not have insurance. So if you have insurance, do not utilize that resource. And then I believe there's something also called therapistden, DEN.com. And those are some of the newer ones that are really making an impact for people of color. But there's the traditional that we know about and has been around for a while, psychologytoday.com and goodtherapy.org.
How do the pressures of work/life, trying to get that balance, the struggle to be balanced between work, balance between life, how does that struggle affect your mental health, both of you?
I'll let Ms. Turner go first.
I am a student right now and I have multiple jobs. So I would say the stress of all of that does get to me every once in a while, but I am currently, I made the decision to go to therapy. I've been in therapy since before undergrad. And that was a decision I knew I needed because I needed someone that was just a neutral person to talk to that I could just bounce ideas off of every once in a while. And that's been helping me to manage those stress levels a lot, as far as school and work.
Okay. It's one of those things that's going to impact your focus, your ability to concentrate. Again, I think it kind of goes back to that stress component as well, knowing how it's showing up for you. But it's going to impact your relationships. It's going to impact your relationship with yourself, how you see yourself when there is not true balance. People are afraid of that word. Many people think that balance really does not exist. It is up to you how you define it and what it looks like for you. It's 7 letters. And for me, 7 is the number of complete. So how are you going to complete that process to make everything align with what's important to you? And if that means that you have to set some limitations and kind of draw a line in the sand and say, okay, I can do this today, but this other stuff needs to wait, giving yourself permission to do that is going to be the key. That is the only way that you're going to be realistic about what's on your plate. You cannot do everything. I know we think we wear capes, but we can't fly. Don't try to, do anything with that cape like that. We are powerful, but we have to be realistic in making sure that we manage well so that we can continue to do the great things that we're doing. You have to take care of yourself. And that's why balance is so important. Be aware of what's on your plate.
You've given some great resources in terms of how to find therapists and counselors, but let's back up for a minute and let's just define what we mean. What are the difference between a therapist, a counselor, a psychologist, so that you know actually what you're looking for? Can you talk about that?
Yes, ma'am. And so I'm going to go with the psychologist first. So there are psychologists that do counseling. A lot of times, some of them may focus more so on evaluations and assessments of that nature, but there are psychologists out there who do provide counseling. And that is something where you probably will find them more so on Psychology Today, and they will specify what their specialization is. When it comes to counselors and social workers, they can do the same thing. So what you're looking for when you're looking for a therapist, you want someone who is going to have the following credentials. Either an LMSW, meaning a licensed master social worker, who is going to be given supervision from an LCSWC, means licensed certified social worker - clinical, or you're going to be looking for someone who is an LGPC, licensed graduate professional counselor, who is getting supervision from an LCPC, which means licensed clinical professional counselor, or someone with just an LCSWC or an LCPC. So you're looking for individuals who have those acronyms behind their name, because that means that they are equipped to be able to support you on your mental health journey.
I'm interested in what are your individual practices? What do you do to maintain mental health balance and care for your bodies, souls, and spirits? Ms. Turner?
Personally, I like to go out in nature. That's one thing that helps me, but I don't like the outdoors too much. So it's more so like the water or just like in the mountains for a little bit. Exercise is another thing, and music is also really helpful for me. So it's those are like the more tangible things, but really quality time with my family and friends is another thing that helps my mental health. It's like a way I recharge and get back into the swing of things.
And for me, I am a therapist for therapists, but I'm also a therapist with a therapist. So talking through things are very important to me. Being able to get out what is on the inside in a safe place is important. But other than that, I am one of those people where I love to rest. I want to sit back and watch Netflix, and I want to munch on something good, or I'm playing with my puppy. So, or me and my husband are running errands. Other than that, I like to just relax because I am always on the go and doing things. Being able to sit is very important for me. Just having that moment to pause and do nothing and not think about anything is critical for my balance.
What's the biggest challenge you face in talking to Black women about slowing down? What's the biggest challenge in that? Because we're very busy and we have a lot of our self-esteem is woven into being busy and constantly doing things for others. But how do you talk to Black women? Because I know you get pushback.
Mm-hmm. The biggest thing is two things that I see that come up. One is understanding how important they are, that they actually matter in that equation of helping people, that they do have to take care of themselves, and that people treat you based on how you treat yourself. So if you are constantly dismissing yourself for the sake of helping others, you put yourself in a position where people start to, and they don't do it intentionally, but they start to say, oh, she doesn't mind. She'll stop this. Oh, she'll help me with this. And what happens is you tell them that you're not important. So the first thing is helping them to understand is that they actually matter. That's hard for women. The other piece is that they think the world is going to fall apart
if they
don't do it themselves.
Yes.
And the biggest thing is saying, I just need you to not do anything.
Right. Exactly.
Let them do what they need to do and you sit back. But the moment that they allow it, it's like an aha moment for many of them where they go, oh my gosh, the world didn't crack open. No, it didn't. See, look, you're right here talking to me. And so I think that that's important to help them to see people can function without my involvement fully.
Exactly.
We have to learn to empower
others.
Right? Empower others, not do it for them.
Yes.
And
now, Ms. Turner, is there a generational for people, younger Black women? What's the conversation around strength and being strong with younger Black women?
I would say the message is carried on generationally. I don't think it's been changed at the moment because we're still taught, be the strong Black woman. We're still taught how to code switch so that in certain environments we fit the mold. Like I know from the people in my cohort currently, like we are trying to make sure we keep the standard. We know we have to work harder to stay in our program. We know we have to do more to get the same benefits as some of the ones around us. So I don't think the message is, I don't think it's ever going to change, at least for a while before.
Well, it's got to change. And I think the work that you two are doing is going to help it change. Thank you. Thank you so much. So now at this point, I'm going to, we're going to shift to Sora Terry Macy Burrell, who's going to set up the social action impact section.
Good afternoon, everyone. I'm Dr. Terry Massey Burrell, and I am the chair of social action for Baltimore County Alumni Chapter of Delta Sigma Theta. When we think about social action, we're thinking about the topic we're discussing today, which is mental health fallout of COVID-19. Today, BCAC aims to make a positive impact with our thrust of physical and mental health. The stress of COVID-19 pandemic, uncertainty, isolation, grief from financial and/or human losses is all key. We think about police brutality and divisiveness among political rhetoric. All of this is really, really important when we're thinking of the whole magnified impact of historical trauma, PTSD, lived experiences, and mental health concerns in our overall community. So as we move forward, it is critical to destigmatize all of these myths. And again, the purpose of today. It often exists around us, and it's important that we're discussing these issues, mental, emotional health, and well-being, in order to address these disparities within the background of the Black community. And as an international public service organization focused on sisterhood, scholarship, service, and social action, together as leaders, we aim to elevate lives. So through these panelists we have here today, through the reimagined public safety, making investments in critical resources through legislation, and addressing the root causes of trauma. We're just thanking everyone for being a part of this critical topic. And we're going to continue to move forward as, again, we talk about sisterhood, scholarship, service, and social action, and the COVID fallout. So we will continue on. And I would like to invite Masora Sharita, as well as, oh, I apologize, excuse me, we sort of shifted for a moment, but I'm going to invite our next two panelists, and then we'll come back to Dr. Marita Golden. Our panelists today, we have Elizabeth Hafey, who is an Associate Director for State Affairs at Johns Hopkins University. as well as we have Dr. Gail Jordan Randolph, who's a board certified psychiatrist and trained in adult forensics and addictions psychiatry. Both of them will talk about social impact and community engagement in each of their roles. So thank you both for coming and joining us today.
This is such an important panel, and this is a great way to conclude today's presentation in terms of the panelists, because this is really about activism and action and making the change that we've all been talking about that's so desperately needed. Ms. Hayfie, I want to ask you first, which of the House and Senate committees of the Maryland legislature specifically address healthcare concerns?
Sure, thank you. Thank you for this opportunity to be here with you all this afternoon. Thank you to Dr. Golden for inviting me. I look forward to this discussion. Great conversation so far. I wanted to say very briefly, Dr. Antoine and Dr. Shepard mentioned this, that this has certainly been at the forefront of the Maryland General Assembly over the last, well, since I've been there, working there over the last couple of years, behavioral health issues, health disparities, certainly, and most notably in the time of the pandemic, looking at the exacerbation of the health disparities that we have been experiencing within the community. So this is a good time for this conversation, really great time for this conversation. And another element here is that this is an election year. So in November, all the 188 seats of the Maryland General Assembly will be up for election. We know that some people are leaving or retiring or moving on to other ventures, but so we will be seeing a little bit of a different General Assembly in 2023. And then we also have a gubernatorial election. So we'll have a new governor administration, and then just for completion, there's the Attorney General's race and the Comptroller's race as well. So a lot happening. I think this is a great opportunity to start thinking about advocacy over the next several months. And certainly these issues are really top of mind to the legislature. So in terms of the committees of jurisdiction, the Maryland General Assembly, there are two chambers. There's a House of Delegates, and then there's a Senate. On the House of Delegates side, there is a Health and Government Operations Committee, also known as HGO, and they deal a lot with health-related issues, substantive policy issues. So you'll see healthcare financing, insurance, behavioral health, of course, health disparities, all of those types of issues will be in that committee. On the Senate side, you have the Finance Committee, which among other issues deals with health-related policy issues. Certainly behavioral health would come before that committee, and health disparities as well. There's also, just to note, there's also another committee, Education, Health, and Environmental Affairs Committee on the Senate side too, that may deal with some occupational board, health occupations boards issues, some licensure issues as well. So there could be some joint assignments between those two committees. One other nuance here is there are budget committees too. So on the House side, you have the Appropriations Committee, and then on the Senate side, you'll have Budget and Taxation. And I bring those committees up because, especially when you're talking about reimbursement for maybe Medicaid or behavioral health services, budget committees are also very important committees to this conversation. Over the last couple of years, we've seen some bills that would have a state funding component. Many bills actually have a state funding component. So you'll see joint assignments to the Substantive Policy Committee and then the Budget Committee.
When we want to advocate to the legislature, what's the best approach to start lobbying on behalf of this issue?
Sure. There are a couple of different ways I would encourage the community. So one way is certainly legislators do want to hear from their constituents. They want to know what's happening in their communities. So that's one way. Their information is on their public emails on the website. If you know who your elected official is at the state level, feel free to reach out to them. There are opportunities to advocate on different pending legislation. So for example, during the legislative session, if a bill is introduced, individuals can come down to Annapolis and testify. They can submit written testimony. They can submit written and or verbal testimony. So those are ways to get in front of the legislature to talk about what the concerns are. Another way is there are a number of state agencies that are looking at various issues. And I'll highlight a couple of committees that are out there right now. And they may have opportunity for public comment and public hearing where they want to hear from people in the community to tell us happening on that line. So they want to hear about that. So for example, there is the Lieutenant Governor has a commission to study mental and behavioral health in Maryland. And I bring that up because there's a hearing that's coming up on May 10th where they're asking for public comment. There's no agenda that has been finalized yet, so I'm not sure what the focus of the exact hearing, but that's one opportunity. There is a behavioral health administration through the Maryland Department of Health that if you look at their website, they have a number of committees, a number of opportunities to get before them. There's a Community Health Resource Commission. And then certainly there are advocacy groups as well, that some of them that have been mentioned already that are looking at this issue. You have the Mental Health Association of Maryland, you have NAMI was mentioned earlier, and a couple of others I'll mention as well. You have, well, actually the Black Mental Health Alliance was already mentioned too. And then in terms of briefings, I know there was a question around briefings with the committees I'd mentioned. Briefings tend to be a little bit of limited experience or limited exposure to do briefings to get before these committees as a whole. So these other avenues, I think, would be the best way to advocate. One other piece one caveat here, I'd be remiss if I didn't mention it. There are, if you're affiliated with an employer or affiliated with an organization, there may be policies around lobbying. So reaching out to your organizations or employers, government affairs, someone in my role, they can serve as a very valuable resource to help navigate the waters when it comes to advocacy efforts here in Maryland. There's certainly some rules around advocacy here in Maryland.
Okay, thank you. Ms. Jordan Randolph, how well do you think the state is doing in terms of evaluating the access to healthcare and healthcare services for diverse populations?
Good afternoon, everyone. Thank you, Delta Sigma Theta Incorporated, for this opportunity and this invitation to participate in such an important panel. My name is Dr. Jordan Randolph. I'm a recovering state employee. That's how I describe myself, having served over 20 years in the behavioral health service delivery system. And thank you for that question. And to effectively answer the question, I'd like to take a step back in time because I think it helps people to understand where we came from. And in the 1990s, this state entered into a partnership and carved out mental health services from their plans to move into healthcare HMOs for Medicaid recipients. And the purpose behind that carve out was twofold. One, there was a concern that continued access to services for severe and persistently mentally ill people would be sacrificed. But the second concern was in order to ensure that Medicaid recipients had access to treatment. And so the impetus behind the carve out was to, one, ensure serious and persistently mentally ill people had treatment, but it was also to grow the Medicaid provider network. And that was in the late 90s. And when that was launched, there was inpatient, there was outpatient, and there were a few day treatment programs. Since the 1990s, the Medicaid service, behavioral health service delivery system, we'll just talk about mental health, has grown exponentially to include inpatient, outpatient, PRP, RRP, crisis services, in-home access to some in-home supports. But I think it's important to understand that there's been tremendous growth in the service system. And on the addiction side, the substance use disorder side, there's been tremendous growth in linking recovery support houses, sober living houses, PHP services and addiction. So the service system has grown. The number of providers, the diversity of our provider network is growing, but there is still more room to diversify our provider network. And so that's where the state system is now. And then that is, I think, an opportunity for advocacy to really work and collaborate with the states through some of the advocacy organizations, such as the Mental Health Association, to prioritize an assessment of the diversity amongst the behavioral health provider network, to benchmark it, and then to look at how developing strategies to support increasing diversification within the behavioral health service delivery system.
Would you say this is a direct result of COVID?
Oh, no, this is the result of building on progress over 30 years.
Okay.
The impact of COVID on the service delivery system was tremendous. What COVID added was the opportunity, it enhanced the opportunity for the integration of telecommunications in the service delivery system, because it was somewhat available through special projects and special opportunities, and Medicaid actually paid for certain elements of telecommunications. Through COVID, it required financiers like Medicaid, like CMS, and programs and the state's management to work collaboratively to really think creatively and out of the box, for fear that critical populations would lose access to continued services, to maintain, or to restabilize, and then to improve access to services for people that were we were in the midst of the pandemic. So COVID actually created that kind of opportunity to enhance remote access to services. But I think it's really important to keep in mind that there are discussions about accessing services and accessing quality services. And that is a robust discussion in systems now and finance. The discussion about, well, what is a quality service? And are people accessing quality services? The other impact of COVID on the state's service delivery system was it required our providers to pivot on a dime, but they weren't funded to pivot on a dime. So if you think about it, they had to provide PPEs for their community, for the—
When you say could you explain what a PPE is? You're
personal protective equipment.
Okay.
Mask.
Just remind us
that.
Yeah. Okay.
Right. So in the midst of when this crisis began, our community mental health providers really had to make a huge adjustment, and for the safety of the community and for the safety of their consumers and their patients, their members. But they weren't funded to do that. Remember, they're funded through a carve-out that's managed by an administrative service organization. So there had to be discussions and reallocations of funding to support the enhanced duties of behavioral health providers in the midst of a pandemic, right? So they had to reprioritize, work with the state administrations to really reprioritize in the midst of the pandemic. What is the priority? The priority is keeping people out of the hospital. So how do you work with providers to say, this is our priority, what do you need? And how do we do it? And so it actually, some of the benefit of COVID is it required creative thinking. It created this opportunity for program managers, for funders to have conversations and start to consider other strategies to support people in the community where they are.
What do you suggest are the best strategies that we could use to advocate and support individuals with mental health struggles?
Thank you. So many of the advocacy organizations have been either chatted or recorded. And so I'm not going to reiterate them, but I will say this. When it comes to advocating, there's certainly three, particularly people with serious and persistently mentally ill. On Our Own, NAMI, and the Mental Health Association are very, very strong. They have a history of strong advocacy when it comes to mental health. And under the Mental Health Association of Maryland, they advocate for addictions and mental health. My suggestion is you can join as members, or particularly as the legislative session gears up, and the legislative session starts in January, I think the third, like Monday after the second full Tuesday. But anyway, I'm flashing back, my apologies. So as the legislative session gears up, these three organizations really track bills very carefully. So this is an opportunity to become aware of the bills that may have impact in your communities around mental health, and they analyze the bills, and they will, provide information. And they have a number of work groups. MHA, the Mental Health Association, has geriatricians or older adults work group, a children's work group, serious and persistently ill, addictions. So there are a number of opportunities. But the other point I really think it's important to emphasize is that all politics is local. And so in Baltimore County, the Baltimore County government is your connection to advocating for your community. And in Baltimore County, the local Behavioral Health Authority for Baltimore County is embedded in the Baltimore County Health Department. That is a great program, and that's another opportunity for you to understand what the Baltimore County's priorities are as it relates to behavioral health. One of them is crisis intervention, and certainly the funding to support an expansion of the Baltimore County current crisis intervention model. And then there is a really expansive crisis intervention planning process that is unfolding now for the state. And Baltimore County is heavily leveraged and involved in participating in that. So I strongly suggest that people can connect with the Baltimore County Behavioral Health Authority at the health department. They have an annual report. You can ask to review the annual report that must be submitted in state government to get an idea of where their priorities are, what their challenges are, their gaps, their funding needs, et cetera.
And this is for both of you, Ms. Haffey, I'll start with you. What's the difference between advocacy and lobbying? And I think a lot of times people may feel that, they have to be part of a group. We often see groups of people testifying or going to the State House. What's the difference between lobbying and advocacy, and working as an individual, working with a group?
Sure. So lobbying is anytime you're trying to influence legislation or other decision, influence an elected official. Now there are, state ethics has really pretty stringent rules when it comes to requirements for lobbying. So if you're getting compensated to do that type of influence, there's certainly requirements there in terms of registering as a lobbyist. Now, advocacy, Dr. Jordan Randolph mentioned MHA, the Mental Health Association, or various groups advocacy groups that are looking at this issue, becoming a part of that group, joining, they have listservs, joining their efforts. And also I mentioned, as an individual, when the next legislative session starts in January, the second Wednesday, January 2023, and there are bills, you can look at their website or go to these advocacy organizations, because they are tracking these bills as well. And we're just mentioning a couple of them. There are others, and Dr. Jordan Randolph mentioned local level too. They're also tracking legislation. They're tracking legislation locally. They're tracking legislation at the state level. So during the session, you have an opportunity to advocate, right? So as an individual, you can submit testimony. You can not just submit testimony, but you can testify verbally, come to Annapolis, be a part of that. You can do it as part of a group. I think as being a part of a group, they're providing the information, and they're looking at the legislation, they're tracking at the legislation. It's sometimes easier to understand what the concerns are and what's out there, what's being introduced when you're following certain advocacy organizations. But there are multiple ways to get your voice heard as an individual.
Jordan Randolph, did you want to add anything?
Well, I mean, and that covers it. And specifically in comparing advocacy and lobbying, I'd like to add a different flavor though, in terms of self-advocacy. And one area I think is really important to consider, and that is when you're choosing the mental health professional you would like to see. That's a part of self-advocacy, and recognizing that process is scary. Because it requires you to trust. It requires you to trust someone to share some of your innermost fears, secrets. It really does. So, I think to self-advocate as you look at or consider engaging in therapy, some really, really critical things to consider. One of them is to ensure that the provider you are considering is licensed. It's very, very important to ensure that the provider is licensed. The second is
how do you ensure that? How do you make sure that? How do you check that?
Right. Well, we Google everything.
Mm-hmm.
You can Google it.
Mm-hmm.
And then you can cross-reference it with if they're a licensed mental health professional. Then in Maryland, there's a licensing board. There's a site you can go in and you can check and make sure that they have a license. It's very important, because these pearls that I'm offering are pearls that are supporting clinical competency and quality, and to ensure that you get the right person with the right background. So licensing. The second is if you have an interest in a certain type of therapy, for example, dialectic behavior therapy or cognitive behavior therapy, and you pull off of a provider list that a provider does CBT, it's important to ask them, what is your background in CBT? Are you formally trained and have certification? Did you take a training course? It's very, very important, because again, the modality, the appropriate treatment modality implemented the correct way will lead to good outcomes. And we want to really ensure that people understand that this is a treatment intervention that can lead to good outcomes, but the expectations have to really be clear. So you want to really know what the modalities that they're using and that they're evidence-based. And then in terms of appointments and expectations, it's very, very important. And I say this all the time, the 3 C's: cooperation, communication, collaboration leads to integration. It's very important as you consider engaging with a mental health professional that mental health professional is supporting the integration of your care in the service delivery system, so that your other healthcare providers can understand some of the challenges that may be associated and may be affecting other health conditions, such as diabetes, such as hypertension. So having the 3 C's and engaging, working with that provider, your personal provider, in detailing a treatment plan and ensuring that there's communication will lead to better overall health wellness.
How has substance abuse impacted mental health? Dr. Jordan Randolph?
It's significant. I mean, it overwhelmingly so. I mean, we're still in the midst, let us not forget, we are still in the midst of an opioid epidemic. And it has been complicated with the impact of the pandemic. And there continue to be significant challenges. And mind you, Maryland has been very creative. Maryland has reallocated funding for creative strategies to really in the community, we say where the rubber hits the road, really frontline strategies. And we're still having significant challenges. And we think that really is part of the residual impact of COVID, but the comorbidity with mental health and addictions. And we really, and again, an area of deficit that we are challenged with is we've grown a service delivery system over 20 years. We've grown a fantastic service delivery system. We still have gaps. One of those gaps is what we would call co-occurring competence providers. So providers that can manage mental health and addictions at the same time. There's still room to build out that provider network.
I want to ask both of you, what grade would you give the state of Maryland dealing with this host of problems? How do you think the state's performed?
I'm gonna
both of you.
Have to go first.
Yeah, good.
I'm not sure I can give a grade, but I will say this, as I mentioned at the outset, this is definitely on the mind of the legislature, and there have been strides over the last couple of years since I've been part of the legislature, been part of the lobbying world. But I think that there is a recognition, a very strong recognition that there's more that needs to be done. And certainly, as we've been highlighting, the pandemic has shown that, but I think even beyond that, there's been this momentum in the direction of recognizing and ensuring that we're bridging the gaps. Dr. Jordan Randolph mentioned a couple of partnerships that are looking at this integrated, crisis system, that we have certainly a number of committees focused on opioid crisis as well. So these issues are policymakers and elected officials are very focused on this, on these issues. I'm not sure I can assign it a grade, but they're very.
That's a political question I should have asked.
It is.
Dr. Jordan Randolph, how do you assess the relationship between, say, group counseling in addition to individual counseling in terms of mental health? Is group counseling a good kind of addition to individual counseling?
So I have to suggest that it really is based on a person's needs. And so for some communities, particularly people that have severe and persistent mental illness, having additional groups to support them and that are targeting specific intervention strategies that help them remain in the community are critical. So it really comes down to the clinical needs of the person. So for example, children do very well with social skills groups and developmental groups. And it creates an opportunity for processing and supporting and allowing them to test, learn social skills and adapt social skills and to improve communication. So there is definitely a role for group therapy. And it really is based on the patient's needs.
How did COVID impact for those people who were uninsured, for example, from job loss? How did COVID impact their access to mental health providers?
So, in Maryland, and this is what we talked about, what I mentioned, the local behavioral health authorities. And for Baltimore County, it's at the Baltimore County Health Department. People that are suddenly uninsured, and so there are two issues. One is if it's a qualifying condition that leads to the loss of coverage, there's some remedies that they should know about. And I would say that I would suggest that they reach out to the Maryland Exchange, because there may be some other options for insurance. One, including COBRA, but again, if it's a qualifying condition, so for example, a qualifying condition is marriage. A qualifying condition is having a baby. When the baby's born, the baby's not automatically insured. The baby has to be added. So that's it. So, and I'm not an expert in that area, but I would certainly say the exchange. And then to keep in mind, at the local behavioral health authorities, if you do not have insurance, you can still get access to mental health treatment through the Administrative Service Organization, because in Maryland, the state of Maryland, certainly through Medicaid, funds Medicaid recipients for behavioral health, but there's also a small pot for uninsured. And so the Administrative Service Organization does have the authority to pay for services for someone who is uninsured. And part of that process is, if they are uninsured, there's an opportunity through case management to help them identify strategies for insurance and refer them to either the exchange, or if they may be eligible for Medicaid.
Thank you both. We now know how to lobby. We now know how to advocate, and we know the internal workings of the system that provides and pays for the kind of mental health that Marylanders need and are getting. Thank you both. At this point, I'm going to hand off to the next segment, the key learning segment. Thank you.
Hello, everyone. Thank you so much for your participation. And if everyone could give us a virtual round of applause for our panelists. My soror, Dr. Golden, is having slight technical difficulties, but she is still on this Zoom meeting. But I will continue on and share with you some takeaways for this particular event. But again, please, let's give a round of applause, a virtual round of applause for each of our panelists. They've done an outstanding job. As we begin to wrap up, and there'll be more time for Q&A, I just want to stress the importance of this interaction that we're having today is related to the importance of being okay about seeking assistance for mental health. And I like to often say, getting healthcare above the neck versus below the neck. We have to be okay as a community in seeking this out. There is something that I wanted to share with each of you that we most recently was in the newspaper just recently, and it was Howard County. Their school system is actually devoting $2.1 million to mental health resources in schools. So that's what we're talking about. School systems, partners, community leaders, putting money where their mouth is, because we need to have a healthy community in order to move forward and to continue to do the important work that we have to do as a community. We've had time today to share resources, to talk about the benefits of having healthcare providers and talking about what insurance covers and understanding exactly what it does mean to advocate for yourself, but also having others to advocate for you. What these partnerships are stemmed from happens to be just the knowledge within the community, and that's what we're gaining today. How do we dispel stigma? How do we move beyond what is required to make certain that we're giving individuals all that they need in order to be successful? How we actually pay attention to the substance abuse and how that is impacting us, and what we need to do in order to reach out to those of us who are strong as well as those who may have had a history of dealing with mental health illnesses. We need to reach out to everyone because with the COVID-19 pandemic, there's been a lot that everyone has had to deal with in order to rise above all of the challenges associated with things that are unprecedented for us in our community. So what we want to do is continue this dialogue, continue collaborating and partnering with one another so that we can find the answers and accomplish the goals that we have within our international organization of Delta Sigma Theta around sisterhood, scholarship, service, and social action. But we also want to partner with all of the neighboring community organizations, as well as our clinical professionals to make certain that we're doing the good work. So without further ado, I'm going to ask my co-chair, her name is Shakia Ward, and we put in the chat that we need everyone to truly complete our survey. And one thing I do want to add as well is that partnerships need to be inclusive of a variety of different community leaders. And as Delta members, we've been spending more time collaborating with our churches as well, so that we can move forward, because I know another question was around spirituality. And when people say just pray on it, is that enough? I think it is enough when we realize that prayer could be finding out about a mental health provider that is someone that you work well with, because we know that we want to select those to work with that are ones that we feel comfortable with. So I will step back and allow my co-chair, Shakia Ward, to explain to you the completion of the survey, and then we have more time to get some more questions in. Again, thank you for your participation today.
And this is actually Marita Golden. Thank you, Sora Terry. And just before Shakia does the wrap up, I was able to figure out how to at least join you by voice. So I sincerely apologize for the technical difficulties with my Zoom, but just to re-emphasize a few points from the clinical side that that Terry mentioned, is that we want to really make sure, remember that one of the key points from Dr. Shepherd is that remembering that mental health impacts our PCWC, it impacts our potential, our coping, our work, and our contribution. And I think that becomes important, because if we see in any of our family and friends that we're noticing changes in their behavior in any of those areas, we should reach out and encourage them to seek the mental health services that are needed. And that there are multiple reasons that suicide rates have increased in our community, not only from racism, but increase in hopelessness in society in general, ongoing trauma, the need for immediate gratification, and then also the lack of access to mental health care. And so we are very fortunate that we have a host of resources like the Black Mental Health Alliance and others. It sounds in July, the 988 number will be open that will also connect individuals to the National Suicide Prevention Hotline. Until that time, the 211 is the local Maryland hotline. And there are a host of really tremendous resources shared throughout the program and in the chat that we will share afterwards. And then finally, as a healthcare consumer, it's important to find therapists that you trust and to expand the definition of family. So, knowing that you have to do what you need for yourself, regardless of what others think of your decisions. And finally, mental stress can show up as physical ailments. So just recognize that. And in order to really participate in your own and promote your own mental wellness, some approaches include journaling, particularly journaling what you're grateful for, setting boundaries, and getting therapy. And therapy doesn't indicate a lack of faith. The scripture that says faith without works is dead. And so some of that work, as was shared with us, is actually seeking therapy. And another key take-home point is that people treat you the way that that you treat yourself. And so we really want to thank, I think that's one of the really important messages from the day, and thank Ms. Lawrence for sharing that with us. So with that, I will turn it back over to Terry to turn it over to our social action co-chair.
Thank you very much, Sharita. And Shakia, it's all yours. And I do see that you are already placing information in the chat.
Mhm. Thank you so much. And so as we wrap up today's panel discussion around mental health, I want to first say, that this has been an awesome event. And so I echo the comments made by Terry, and I also echo the comments made by some of you in the chat. So thank you so much to the panelists for joining Baltimore County Alumni Chapter today as we continue to share information to our community, with our community. So again, as we wrap up, there is a QR code that is on the screen today. There has been a link placed in the chat. Your feedback is very, very important. The responses that we gain from the feedback helps us as a sorority, as a chapter, plan for future events. And so again, thank you so much for attending today's event. And thank you to all of the panelists for sharing and educating us today. I've learned a lot, and I'm sure many on the call have learned a lot as well. Here are other committee members. So thank you. A special shout out to our committee members, Physical and Mental Health Committee, also joined by the Social Action Committee. So thank you all for your help to kind of help implement and carry out today's event.
We still have a little more time for a few more questions. If Ms. Marita Golden could be spotlighted again, and as well, Ms. Golden, if you would like to share any information about your book, that would be great at this time as well.
Oh, well, thank you for giving me that opportunity. It's interesting that we're talking so much about COVID, because my book, The Strong Black Woman, How a Myth Endangers the Physical and Mental Health of Black Women, was written during the lockdown between March of 2020 and September of 2020. And it's a book that challenges the notion that the strong Black woman complex, which we were pretty much all raised on, is only a good thing. In the book, I look at the kind of the dark, toxic underside of the belief that Black women are supposed to be strong all the time, that we are supposed to be the go-to fix-it person in our families, in our communities, and the ways in which that leads us to neglect our physical health, our mental health. And actually, Black women are in the midst of a health emergency, because we are now the fastest growing group developing dementia. We have off the charts rates of diabetes and many obesity related illnesses like heart disease and stroke. And this is a generational project. And I've been very pleased to see that this is a project that Black women of all ages, all backgrounds are interested in challenging the idea that Black women have to be strong all the time. So I've gotten a really wonderful response to the book, and Marita Golden has been a big fan and supporter and connected me with Hopkins and allowed me to use the book as a platform to talk with many people about the importance of mental health. And this is a book not just for Black women, it's a book for anybody who cares about Black women. It's a book for anybody, period, no matter their racial group, who wants to understand the experience, the Black experience and Black women's experience. So it's been very gratifying and satisfying to write the book. And in the book, I privilege the voices of Black women who'd been through therapy, and they talk about the journey from trauma to healing. So I thank you for asking me that question.
I had another question, and it is related to, and any of the clinicians could respond, and that is in regards to individual versus group counseling. I know we spoke on that just a bit, but just wanted to get someone to elaborate on that, particularly for those who may feel a bit of apprehension, whether or not being in group counseling would alleviate some of that concern because you're amongst the others who are dealing with similar matters. Just anybody who has any thoughts around that.
I think there are a lot of ways of looking at it. The norm is what we've talked about a lot with all the providers and the counselors, and group counseling can make sure that there's increased awareness of what other people are going around, so you don't feel stigmatized with the issues that you're going through. So I think that's where group counseling can be helpful, but it doesn't solve everything because there's individualization of what each person is going through. So that's where the combination of both could be helpful. It's similar to saying counseling alone may not always be the way. You might need medication. It really depends on what the person is going through. So I think there's a benefit for group versus individual counseling, and sometimes you can need a combination of both depending on the circumstance.
I think one more question. This will be the last one. Dr. Antoine or Dr. Shepherd. We had heard about the differences in, sort of like a psychologist versus a clinical social worker, et cetera. Can you explain when someone might need a psychiatrist in addition to a counselor, like what, just sort of where that difference comes in? What is it that you all do that sort of augments what a therapist does?
I've been using an analogy for this recently that might help. If you think about surface area is defined by length and also width. Psychologists and psychologists definitely have a great amount of depth into talking about the individual issues and using therapy. But what you talk about with a psychiatrist is that we have a width, a breadth of knowledge across the medical and biological realm that may not be there with the counselor or psychologist. But at the end of the day, there's still the same amount of surface area when you add those dimensions. So I would say with counseling, if there is a severe psychiatric issue, it may be helpful to have counseling, but you might need those biological aspects along with medications to address what's going on as a complement to that. And that would be where psychiatrists would come in.
All right, great. Well, thank you all. We hope everyone has a great weekend. The weather's nice, at least in the mid-Atlantic area, so that's good for like mental wellness. So hope that you can enjoy some of that. So thank you very much.
Thank you.
And we want to thank our panelists. Thank you so much for spending time with us.